Well, good morning, everybody, and welcome to AlphaBiolabs' Learning Lab entitled From Collection to Courtroom, Getting the Drug and Alcohol Testing Process Right Every Time. It's great to have so many of you join us this morning. The webinar will probably last for about 40 to 45 minutes. So as a way of introduction, my name's Andrew Priestley. I'm the Legal Marketing Manager at AlphaBiolabs, and I'm joined today by my colleague Ashley Friday, who's our Sample Collections Manager. In terms of the agenda, there's quite a lot to cover here. I'm just going to open up by talking about the increasing threat of non-standard drugs in family law cases. I'll then hand over to Ashley, who's going to take you through the full sample collection process, including the differing approach required for taking children's samples. Ashley will then cover the application and benefits of repeat drug and alcohol testing for a particular case. And then I will close up the presentation part where I'm going to talk about how cutoff levels make reports easier to interpret and defend in court. We'll then conclude with our usual Q&A. We've had a couple of questions in the registration when people have been registering, so we'll answer those questions. If you think of any other questions during the next half an hour or so, then please do put them into the Q&A on the Zoom technology which we're using today, and we will answer those questions as well. If we do get a lot of questions, we don't have time to answer them all, don't worry, we will send you an email with a personal response later on today. Okay, let's get started. So the increasing threat of non-standard drugs in family law cases. So just to open up really, I just want to emphasize the importance of thinking about other types of drugs when you're instructing a testing provider like ourselves for drug testing. This is a really useful report. It's from the Office of National Statistics. It's called Drug Misuse in England and Wales. It's an annual report. These stats are actually from the year ending March 2024. The report ending March 2025 is due to be released imminently, but unfortunately it's not been released as yet. So we're referring back to that time period, but it's still a fairly recent time period. Basically, the report's taken about 35,000 households per year asked to participate, and one individual within each household is asked the questions. The results are then sort of statistically representative of the population. I think the key message to start with is that there was no significant change year on year really in terms of overall drug use, but possibly there was a bit of a shift in the makeup of the usage by age group and certainly actual type of drug taken. So we can see here key metrics. So 8.8% of 16 to 59-year-olds reported using drugs in the past 12 months. That equates to just under 3 million people. And even more worryingly, from a younger age group, so the 16 to 24-year-old group who were included in the survey, it equates to about 16.5% of that age group reporting using drugs in the past 12 months. That equates to just under 1 million people. And when we talk about drug usage here, it could be as little as just one drug usage per year, but it can be more frequent than that. In fact, with this next bullet point, you can see that 1.8% were estimated to be frequent drug users, which means they take drugs at least once a month. Slightly more positive message, if you can have one here, is that cannabis and crack cocaine, two of the most commonly used drugs in the UK over the years, and certainly the most in the sort of top court ordered drugs, their use decreased year on year. However, still 3% reported using a Class A drug. So then just a few graphs to show you really. So looking at, again, taken from the report. So this first one looks at a number of what we call top court ordered drugs. So you've got cocaine in two formats. You've got powder and crack cocaine, and then you've got ecstasy, which is a type of methamphetamine, and amphetamines in general. And you can see this survey goes back a long way. So it goes back to the mid-90s. But what's interesting is if we look more recently towards the end, we can see that powder cocaine actually has probably decreased a little bit, but we would still say 2% of the population have used powder cocaine at least once in the last 2 months. And then you've got ecstasy and amphetamines a little bit lower than that, sort of around the 1%, 1.5% mark. And then crack cocaine, we know how lethal that is. There are an element of people still using it. Unfortunately, it is very low. And the next slide just does a comparison. So again, it's for the full range of adults 16 to 59. But what I've selected here are 4 other drugs, which normally you wouldn't say they were top court order drugs. So we've got anabolic steroids, which have been around for a long time. They're a prescription drug, but we know they can be used for recreational purposes. Sort of around 0.5%, not even 1%, are probably using it, but they're still there. And they're the sort of things that are not always addressed in family law cases, yet their impact can be significant. Mainly used by men to enhance their appearance and performance, but excessive usage can lead to aggression, mood instability, and ultimately impaired judgment. You've then also got magic mushrooms, ketamine, and LSD. They're all types of hallucinogens, and they are always gaining popularity too. Ketamine in particular, there's been a lot of press and TV coverage about the increasing use of ketamine in recent years across the UK. All these types of hallucinogens can induce paranoia, disassociation, impairing emotional regulation and risk perception as well. So these are all the sort of symptoms that you might have a particular case where it's noticed in the person who's going to be tested for drugs. So it's looking at those sort of signs as well and thinking maybe we should be doing a test for, things like prescription drugs and hallucinogens as well. And really what we're saying there is looking slide on slide, the level of use across the population is of a similar level between the top court ordered drugs and these other types of drugs. And then finally, I've just broken it down for the younger age group. And again, I think the message is even clearer here. I mean, there's some positives on this slide in terms of if you look at amphetamines, for example, going back to the sort of mid-90s into the 2000s, I mean, it was double figures. It was 10 to 12% of that age group were using them. More recently, it's more like the sort of 1% mark now for amphetamines. Crack cocaine, fortunately, is very low as well. Powder cocaine has seen a bit of a dip, but there's still about 4% of that age group that probably do use powder cocaine at least once a year. And ecstasy, which you'll have heard of, has taken a little bit of a dip as well, but it's still around the 2% mark. And then looking at those other drugs for the younger age group, you can see that ketamine, which sort of came about around about 2008, 2009, you can see from the graph there. It peaked about 2 years ago, about 4% of 16 to 24-year-olds were at least trying ketamine. It's dropped off in the latest report, but it's still about 3%. And then you've got your anabolic steroids are still there, but fortunately at quite a low level. And you 2 other hallucinogens, magic mushrooms and LSD, around about the 2% mark. So again, similar sort of message for that age group is that they need to be considered because they are being used at the same levels as your more traditionally sort of court order drugs. So talking about steroids, which is just one type of prescription drugs, and I've just listed a few others here that you might want to consider. A real concerning statistic came in 2024 from the Medicines and Healthcare Products Regulatory Agency, or the MHRA. They did a report in collaboration with law enforcement partners in the UK. These partners seized over 17 million doses of illegally traded prescription medications across the UK, with a potential street value exceeding £40 million. And these drugs you can see on the screen would have definitely been part of that. So you got your benzodiazepines, things like diazepam and temazepam, which are normally used to, they're normally prescribed to relieve anxiety, to help with sleep. They're constantly being used or increasingly being used for recreational purposes. Gabapentinoids such as gabapentin and pregabalin, they normally prescribe for things like epilepsy or nerve pain. Because they're a sedative, they do have extreme relaxing effects. So again, people do use them illegally. And then opioids, things such as tramadol and oxycodone, normally prescribed to deal with very strong pain. But again, another sedative, which can even give euphoric effects. So what we're seeing is increasingly these types of drugs are being used across the UK, and they should be considered on a case-by-case basis when you're thinking about what drugs need to be tested for your client. So just to finish off, these are our drug panels at this time at the moment. So we've got a standard panel on the left there, top 9, what we said, top 9 court-ordered drugs, so the more sort of traditional drugs. They're obviously still used, and they appear in a lot of court orders. They have to be considered. We have, in the last couple of years, added ketamine to that list. You can see there on the left, because, as I said earlier, because of the increase in use of ketamine across the UK, which is quite alarming, really. But we do have a very comprehensive non-standard panel on the right-hand side. There's at least 25 different drugs or drug groups there to be considered. We can test whatever combination is required. As an example, I've selected from the non-standard panel there the 5 other types of hallucinogen, 2 of which we talked about earlier, so LSD and magic mushrooms. But you've also got DMT, mescaline, and phencyclidine as well. So again, you know, if you're unsure about what you think you should be testing for and you're aware of the symptoms of the sample donor, then please reach out to our team and we can give you advice on that in terms of what we think the drug should be tested for in that particular case. How to request a quote, just to touch on that, but you can go onto our website, alphabiolabs.co.uk. We've got an online web form or a downloadable PDF form, but by all means you can call the team as well on the number there, 0333 600 1300, or just simply drop us an email, testing@alphabiolabs.com. Again, we just explain the basic requirements for the case and our team will contact you to discuss that further. We can provide you just with a quote at the time, because you might want to compare it with quotes from other testing providers, or we can quote and proceed, so we can proceed immediately to the case once we've issued that quote to you. We also have our price promise, so we will beat any like-for-like quote by a further 10% if pricing is an issue for you with our quote. And finally, once you do instruct us, you will have a dedicated case manager. So from the point of instruction to delivery of your court-approved test, your case manager handles absolutely everything. So it's one point of contact for you. The sample donor will be contacted within 2 hours of case registration. The donors are always treated with empathy, dignity, and respect. Coordination of the collection with regular updates to yourself as the instructing party. And again, progress updates to you from receipt of sample at our lab all the way through to us issuing the report. So hopefully you found that useful as a starting point to the webinar today. I'm now going to hand over to Ashley, and she's going to talk to you about the sample collection process. Ashley.
Hello, good morning. Thank you for joining us. So I'm going to talk through what happens at the sample collection appointments, how we decide what samples that we'll take, and what information is provided to clients and yourself for that process. So starting off, if we're looking at testing a sample of head hair, if you've been to one of our webinars before, you'll know that we've spoken about the average growth rate being 1 centimetre per month. What that means is that at every appointment where we're instructed to take a head hair sample, we need to have a look at the client and determine if they have a sufficient sample for your requirements. Now, this is something that we discuss at the point of booking as well, just to make sure in advance that we don't need to explore any other options. For drug and alcohol testing, we can go back up to 12 months. So if we base that on the average growth rate, you're looking at up to 12 centimetres of head hair, depending on what you instruct. So if, for example, you were looking at doing a 6-month test, when we arrive at the client's home or at your offices, wherever we go to take the sample, we would look to see if they had 6 centimetres of head hair. And if they didn't, look at alternative samples that we could take. This is particularly important when we look at the type of analysis that you require. So if you request an overview analysis, you would be choosing usually between 3 or 6 months worth of analysis. However, if you'd had month-by-month segmentation, you could pick individual months all the way up to 12. So what we would look at is if you had requested for a 6-month overview and your client had 5 centimetres of head hair, we know then that we can only provide a 3-month overview. So we may look at an alternative sample, whereas if you'd opted for month-by-month segmented analysis, we could do up to 5 months instead of 6 months. So we always have a look at that, what your preference is, which you're asked for when you register. So on our referral form, we will have a section that states, if your client has an insufficient sample, what would you like us to take instead? And there's a couple of different options on there, which I'm going to talk through now. So one of the options would be that we could take a body hair sample. So this would be anything really, underarm, chest, leg, back hair, whatever your client has available at the time. But that would provide a 12-month overview of the testing. So we'd need to know if that would be suitable for what you're looking to prove or disprove, or if an alternative sample would be better. If your client has beard hair, depending on the length of the hair, we could potentially look back up to 12 months as well. Now, beard hair does have a growth rate applied to it. However, it is different to head hair. It's not as straightforward as 1 centimetre per month. So depending on the length of the beard hair would depend on what the time frame would be exactly. But again, that would be reported as an overview. And these are things that we look at when we attend the appointment. If you wanted, for example, a 3-month overview, and your client had no head hair at all, but they had beard hair, that might be the better option to get as close to that time frame as possible, rather than to take a body hair sample where we would only be able to provide 12 months as an overview. Some other options are to look at nail clippings. So we can take fingernail clippings that would provide up to 6 months as an overview, and toenail clippings that would provide up to 12 months as an overview. So again, we'd weigh this up with exactly what your request was versus what your client had available at the time of testing. So that's for longer window testing. For short window testing, or narrow window as we refer to it, we could look to take an oral fluid sample. Now, this wouldn't be in place of a head hair sample because of the time frame differences, but what we can do is we can use oral fluid testing to support with any other result that you may have. So this would just be a sample, like a swab, a mouth swab sample, and it would look back up to approximately 2 days from when the sample was collected. And that's why we refer to it as narrow window testing. You're not looking back months like you are with head or body hair. It is just 2 days from when the sample was collected. But in certain cases, this can be really beneficial. Another form of narrow window testing would be urine samples. So we can collect a urine sample. This would cover approximately 4 days from when the sample's collected. Again, used alongside that wider window of testing. This can be really useful as well. We do have to make sure that urine samples aren't adulterated, so that they've not brought them with them or anything like that. And for this reason, we can only offer urine testing at our walk-in centres. So just so we can control the environment and make sure that it is a genuine sample that's been provided, alongside other checks that we do to ensure that it is a genuine sample. Another option is that we can look at blood alcohol testing. So we do 4 different types of blood alcohol testing here at AlphaBiolabs. 3 of them can only be done via venipuncture. However, if you opted for PEth, we can do venipuncture, or we can do finger prick or dry blood spot testing. So if you did have a client who had a needle phobia, this is an alternative option for sample collection as well. And we'll discuss that with them at the time of the appointment to say if it is only for PEth, then we could offer that as an alternative if they would prefer that. Periods of detection depend on what type of test you opt for, but the minimum testing period for blood is 1 month. So we have a look at all these things before the appointment. We'll discuss with your client when booking the appointment, or with yourselves if we're booking through you, about what the requirements are, what types of sample we require, and then any other additional information we might need to provide. For example, if it was a blood sample, we'd want them to be well hydrated. We also have a few other things that we want them to be aware of before the appointment. And so what we do is we will send them a text message with a link to all of this information that they can read through, and it's specific to the type of test that they are being asked to do. If we have ordered the testing through yourselves, so if we book the appointment through yourselves, you'll get an email with that information on as well, so that you can pass that on to the donor so they're well prepared in time for the appointment. This also means that if they have any concerns or queries, they can raise this with us before we get there, and then we can look at alternatives if there are any main issues, particularly things like them not having a sufficient sample. So within this information, we advise them that they will need to provide one form of identification where possible, ideally photographic, so something like a passport or a driving license. The appointment can still go ahead if they don't have identification available, because we'll take a photograph of anyone that provides a sample so that we can identify who that person was. But if they know in advance, they can have that ready for when we get there. For hair samples, we always ask that the hair is dry at the time of the appointment, so not fresh out of the shower or anything like that, and that it's free from any oils or gels if possible. And we ask that the nails are free from any acrylics, shellacs, biabs, things like that, and nail varnish. We will carry with us some nail varnish remover, so if they do have that on at the time, we can take it off and the appointment can still go ahead. But for things like acrylics and shellac, they will need to have them removed prior to the appointment. So we just like to make them aware of that, again, to avoid any reason for the appointment to not go ahead. We do ask that they avoid any chemical treatments on the hair, such as bleaching, dyeing and perming up until the appointment. This is really useful information to have as well. If you're putting this in as part of a court order, you could include that they're not to bleach, dye or perm their hair from when the order was stated until after the appointment's taken place. If you've been to some of our webinars before, you can find them in our Learning Centre on the website. We speak about why that affects testing and how that affects testing. And they're all covered in there. So if you were interested in that, it may be useful for you to have a little look back at some of the previous webinars we've done for that information. We also will ask them about any medication that they take that could have influenced the testing, or that they may have already disclosed to you but will come up in the testing. So we ask them all about that, and we ask where possible that they provide the prescription. Just makes it easier for us to take off the exact spelling of the name of the drug, the dose and the frequency that they're taking them at. And then we also ask about if they have any other things that we should be aware of. So if they have any accessibility needs, particularly if they're attending one of our walk-in centres, so we can make sure that there's something in place for them, or any religious or cultural needs, other things such as translators or chaperones to appointments. Again, this is featured on our referral form, but we will ask as well, just to make sure that we can accommodate them and make them as comfortable as possible when providing the sample. So that's before the appointment. At the time of the appointment, we will advise the client that all appointments take between 30 and 45 minutes, depending on the type of sample. And obviously when we book them, we'll advise of this as well, just to make sure that they've got enough time to see us and for us to go through our questions and collect the sample. As I mentioned before, we'll ask that they provide one form of identification, and we'll also ask them some questions about verifying who they are, so dates of birth, things like that, anything that might affect the test. We'll take a photograph of them, not just of them as the person that provided the sample, but also of the sample site that the hair sample was taken from, particularly if it's a head hair sample. So we'll take a photograph of that as well at the end. For collecting samples, if it's a head or a body hair sample, we will use clean scissors to do this. So we'll cut directly from as close to the root as possible. And all equipment is cleaned before and after each collection in the presence of your client, so they can see that that is done. For body hair samples, we could also use a razor, a disposable razor, depending on what's more appropriate, but it'll either be a scissor or a razor for a body hair sample. And then for nail clippings, they're just cut using nail clippers, sorry. Again, it has to be something that we do in front of the client. So the sample collector is the only person to handle that equipment, just so that we can make sure that the sample came from that person, it was collected at the time that we were there and that we witnessed that collection. And all of this forms part of the chain of custody. So it has to take place in this way. So speaking of chain of custody, all the samples are packaged in front of the donor. So even once we've taken the sample, the person needs to stay with us until the full process is complete. We'll explain to them how many samples were taken and the size of the samples that we require before we take any of the samples, just to make sure that they're providing informed consent and they are aware of exactly what we're going to do. And we'll talk them through the whole process before we start. We'll then get them to complete their consent form. So this includes all of the personal information that I've covered, and they'll sign to say that that information was correct at the time of the sample collection appointment. They can also get a copy of this so that they can query any information within 48 hours of the collection process if needed. The samples then tracked at all stages, so from the point of collection all the way through to the results being issued to you. And that just means that the chain of custody is legally defensible. We have to be sure that we can confirm who the sample came from, how it was collected, packaged, sent, and then all the way through up until the report's issued at the end. So that's the process for adult sample collections, which is the majority of the work that we do. Unfortunately, every now and again, we are asked to take a child's sample. This is usually conducted alongside a parent's sample to determine if the child has been exposed to a drug, although the sample collection appointments tend to happen separately. Children's hair samples have to be handled slightly differently to adult samples for a few different reasons. So they are more sensitive to contamination and they're at a higher risk of environmental exposure. This also means that the growth rates can vary depending on the age of the child and also the child's health. And for this reason, when you request a test for a child, we would tell you that having an expert report is mandatory. We cannot report just off a certificate of analysis like you can get for an adult sample because of all these varying factors. We need to make sure that you have all of the information required. So if you were to instruct us to obtain a child sample, you must have that expert report included. Again, just to state exactly what the differences are and how that could have affected the sample. Because of these variables, the sample that needs to be taken from a child appears to cover a much larger area. The reason I say this is that the weight of the sample is exactly the same between a child and an adult. So for both, we're looking at least 20 micrograms of hair per sample. However, for a child, because the growth rates can vary and children's hair can be much finer, the sample site size can appear to be much bigger. And this is something that we really make sure you are aware of before we come out and take the sample, because it may be determined that it's not appropriate to do that to the child depending on their age. So we always want to make you aware of that. If that is the case and you think that that's not appropriate, we can look to test nail clippings as an alternative. Again, it's entirely up to you as to whether that would provide the information that you're looking for, but we want you to be well informed when we're doing these types of samples, particularly because they're so sensitive. This also means that an adult with parental responsibility must be present throughout the process. Now, they don't need to sign PR. We can obtain that prior to the appointment, either via an interim court order or a consent form sent to another parent, if that's who holds PR for the child. But a responsible adult must be with them who can sign as a witness to confirm that the correct child was tested and also provide required information, because we will ask the questions about things like any treatment that they use on their hair, any medical shampoos, things like that, any medication the child might be taking. So we need an adult with them at all times to ensure that we can get that information and have them sign as a witness to the sample collection appointment. So if you were to instruct us for this, it'd be a little bit of a different conversation than with an adult, just to make sure you're fully aware of all the options and that it's appropriate for the sample collection appointment to go ahead. Sample collection appointment wise, we have a team of collectors based all over the UK, so they can come out to any address in the UK or Ireland, including your offices, the person's home address, a friend of the person. If they don't feel it appropriate to take place in their home, that's absolutely fine. as long as the friend obviously consents to us being there. But we can attend various locations, prisons, things like that, absolutely fine for us to attend to obtain a sample. If it's not appropriate to go out to an address, they can come to us. So we have 21 sample collection centres, again based across the UK and Ireland, and we offer free sample collection appointments at those locations as well. So there's a few different options. If your client's not comfortable with us going to them, they can come into us if appropriate. So that's a sample collection appointment. In relation to the application and benefits of repeat drug and alcohol testing, we're just going to look at a few different options now as to when it would be appropriate to do repeat testing for a particular client. So in relation to drug testing of samples, we have narrow window and wide window detection, as I mentioned earlier. So your narrow window detection would be either your oral fluid or your urine, which you're looking at either 2 days or 4 days, depending on which one of those you opt for. And then you've got your wide window of detection. So your head hair, your body hair, and your toenails, which can go up to 12 months, depending on what sample your client has available. And then fingernail clippings, which is up to 6 months as an overview. When we look at alcohol testing, you've got a few different options. So you've got a breathalyzer test, which is just testing the here and now. So something that you may want to do repeat, say in advance of contact with an adult to make sure that they're not under the influence of alcohol at the time of contact. That would probably be the most appropriate use for a breathalyzer sample. Then you've got your blood tests. So as I said before, we've got 4 different types of blood test. PEth is your direct marker of alcohol, so it's only present if alcohol's been ingested. That type of testing covers approximately 1 month, as does a CDT. And then you've got your MCV and your liver function test. So your MCV is covering up to 4 months as an overview, whereas your liver function test is just a snapshot in time. So it's just looking at how the liver is functioning at the time that the sample was taken. Then again, you've got your head hair testing, so up to 12 months, body hair and toenails all up to 12 months. Just make a little note that obviously body hair and nail clippings are ETG only. Head hair is ETG and ETPA, and we'd always recommend that you do those together where possible. And then at the bottom, we've just put some examples of repeat testing. So it's important to remember that it's not just short-term testing that you can do repeatedly. So here, one of the examples we've used is a PEth blood test. Because it covers up to a month, you can do that repeatedly every month. But what you could also look at is doing repeat head hair testing. That can be really useful. For example, if you did that every 3 months alongside some narrow window testing, or you can use a scram bracelet, which is at the bottom of the screen there, and that takes a reading every 30 minutes and can be worn continually over a period of time. So it totally depends on the situation and your client's situation as to which one of these would be more appropriate. The benefits of repeat testing, it can give clarity over time, so it can show patterns of use, relapses or abstinence. So particularly with something like your PEth blood testing, that's really beneficial for patterns of use because that can determine abstinence or social drinking. So doing that repeatedly over a longer period of time for someone who's maybe trying to abstain from alcohol consumption would be really beneficial. It can prove evidence of compliance, so showing that someone's adhered to a court order or that they've gone through a rehabilitation program and then been able to continue that going forward. And it can improve safeguarding as well. So it offers an additional layer to a safeguarding report, or it can help provide support in our findings versus any other findings that are included in the case. So it allows you to act quickly, particularly with narrow window testing as well. You're not waiting for the person's hair to grow and then taking the sample. You can do repeat urine or oral fluid testing, which covers short windows. So there's lots and lots of benefits for repeat testing. We just wanted to show you or share with you a case study where repeat testing had been used. So for a little bit of context behind this, it was a mother with a history of cocaine use whose child was removed from her care at birth, but then returned to her under a 1-year supervision order at 6 weeks of age. The testing details was that she was required to complete repeated hair strand testing over a 15-month period, also accompanied by some urine testing 3 months before the court hearing. We'll look at the court findings on the next page. I'll show you what the outcome was. But overall, when it was reassessed, the supervision order was extended for 12 months with reviews in place, and repeat drug testing was to continue. So instead of the child being removed from her care completely, it was that the supervision order was extended so that the child could stay with her. These were the results of the case study. So the first test that was done initially was a 3 centimetre sample, so looking back 3 months, and that sample did detect low-level cocaine within the system. Then 6 months later, she did a second hair sample, which was 6 centimetres in length, so covering 6 months, which also had low-level cocaine detected. Now, this is a lady that was trying to obviously abstain from using cocaine, which is why the urine samples were done alongside of this. By the time the third head hair sample was collected, again 6 centimetres covering 6 months, that sample was negative, as were the regular urine samples tested. So there's a few reasons as to why that low-level cocaine could have been detected in those first 2 samples. Obviously, there's an element of residual use within that. But there's a few other reasons as to why that could have been there. But being supported by those regular urine samples where she was testing negative just helped build a better picture. So that meant that when the court hearing came back in the second year, they extended the supervision order, not solely based on the testing requirements, but also on other findings, such as social worker. So a real benefit to that repeat testing, had they have just done that initial test and determined that she had low-level cocaine use, that outcome may have been different. But testing her frequently over time, particularly accompanied both wide and narrow window testing, really helped.
Thanks, Ashley. That's great. Okay, so just to finish off, I'm just going to talk about how cutoff levels make reports easier to interpret and defend in court. So the reason I just want to summarize this really to finish off the presentation is that there's been a lot of talk, both at events and in the press, about the benefits of using cutoff levels in toxicology reports. There's been a couple of other testing providers who don't believe you should refer to them at all. So we just thought it'd be a good opportunity to be clear in our stance, our sort of position on this. So I've just summarized it really on the slide here. So firstly, what I would say is that, cutoff levels do play a crucial role in the accuracy of drug and alcohol testing. Without them, even trace amounts, very small amounts of substances could be reported, potentially resulting from, could be just from passive exposure to drugs rather than active and frequent drug use. One example of that is something called the cocaine kiss. So cocaine can dissolve in saliva and be absorbed through the soft tissues in the mouth. So this means that even a very small amount of cocaine has the potential to be transferred to a non-cocaine user through kissing. And due to the sensitivity of modern day drug testing, this can result in that person testing positive for cocaine, even if they did not actively use the drug themselves. However, if you always apply the cutoff levels when reporting, it would prevent this type of scenario from happening. So we absolutely at AlphaBiolabs, we follow the internationally recognized cutoff guidelines set by the Society of Hair Testing, or the SOHT, who base their recommendations on extensive research across a diverse range of populations. And these scientifically established thresholds are really based on data from thousands of cases going back over a number of years, covering a wide range of sample donors. The values themselves, or the levels themselves, are reviewed regularly to reflect advancements in drug and alcohol testing technology. They are designed to distinguish between actual drug or alcohol use and things like Ashley said about incidental environmental exposure, to prevent misleading conclusions. And ultimately, they provide a benchmark or a shared standard across reputable and accredited testing labs to ensure, I would say, fairness, consistency, and accuracy in testing. And ultimately, these reports are designed to identify if somebody is a frequent or a heavy user of a particular drug. And by applying cutoff levels, you will always find that in your conclusion. However, that being said, just by using cutoff levels does not mean that our reports are just data-driven. They're absolutely not. So we will use those cutoff levels, but each expert report also includes a full interpretation from the person writing the report, and it will take into account facts, some of the things that Ashley mentioned, so information from the sample donor, cosmetic treatments, medications, any potential for external contamination. And it also looks at other factors too, such as hair type and colour, and even hair growth rates. So all those factors are taken into account with a full interpretation with an expert report. So really just to summarize, cutoff levels are absolutely essential for expert reports. They do bring a balance to a process that ultimately must be precise and fair to all parties concerned. Okay, so that brings us to the end of the presentation. We're now going to move to the Q&A, 5 minutes. We haven't actually been asked any live questions as yet, but there's still time. If you've got any questions, please just open up that Q&A on the Zoom technology and send your questions to us. But we did have 3 questions from the registration, so we will answer those questions now, and any others we can send you an email response later on today. So just looking at the questions we've had, Ashley, one for yourself, please. You've covered this really, but it's worth reiterating. So does aftershave affect alcohol testing? Recently, this customer's had results back on a male as having chronic and excessive alcohol use, and he states this is down to using aftershave in his hair, but he did not disclose that at the time of testing.
So potentially, yes. So it could potentially affect the ETPA level. It wouldn't affect the ETG level, but it could potentially affect the ETPA level. So if they've given a head hair sample, hopefully they've tested for both. If you have the elevated ETG, then it won't have been affected by that type of thing. This is why we ask this question on the form when we take the sample. But as she said, if he didn't declare it, then we couldn't have commented on it. Had he have declared it at the time, we could have included that in the expert report as to whether that would have affected it. What I would say is that if this is still a concern, if they have more queries about it, to send it in officially, just so that we can comment specifically on what the result was, the level of ETG versus ETPA, and whether that could have affected it. But yeah, the bottom line is potentially, which is why we asked that question.
Thanks, Ashley. Next question, which I can answer. So what are the timeframes for consumption of drugs to show in different types of tests? And I think in answer to that, I mean, Ashley's covered a lot of that. So as you saw in her presentation, she talked about both narrow window and wide window methods of drug testing, and also the start of the period of detection depending on the sample type. So for example, with a head hair samples period of detection, that would normally start from about 2 weeks prior to the date of the sample collection, and that would apply for both head hair drug and alcohol testing. What I would recommend is that there will be a very short survey when we log off in a moment. Please complete it, because in that we have a very useful summary guide, and you can request a copy of that from us in the survey. It covers everything that Ashley's covered today, and it will give you those different times of detection periods based on sample type for both drug and alcohol testing. So I would recommend you request a copy of that guide from us. You can request it electronically, or we can even send you a hard copy if you prefer. Okay, last question before we finish. Ashley, are we to rely solely on the hair strand testing or head hair testing when looking at the potential removal of a child, or at the whole picture?
Again, I think we kind of covered this. No, we wouldn't base it solely on the hair strand results, as we discussed and looked at in that case study. It can be affected by other things. So therefore, we would say to use it as like an additional support to any other findings that you already have, any other reports you've done, like welfare checks, things like that. We would always say to use it in addition to, as a supporting document, not in isolation.
That's great. Thanks very much, Ashley, and thanks for your presentation today. Okay, we're not any more questions through, but there is still a couple of minutes. If you can think of anything, just drop us a quick question and we can send you an email later with an answer. So finally, I just want to say thank you very much for listening this morning. Hopefully you found the presentation of use, or the Learning Lab, I should say. As I mentioned then, before you log off, please just take a minute, only take a minute of your time to complete our survey. Your feedback is really invaluable to us for the planning of future learning labs for next year. And as I did mention as well, you can see a screenshot of it there. We do have a very useful drug and alcohol testing, like a summary of testing options guide, which will really summarize everything we've talked about today for you. So please do take a moment to complete the survey at the end. So just to finish off, please do get in touch with us. We do provide drug, alcohol, and DNA testing you can trust. All our key methods of contact are there for you on the screen again. So our web addresses, main email address, contact number. We're also very active on LinkedIn and X. If you are, please do give us a follow and we'll follow you back. And finally, I just wanted to mention our Giving Back charity initiative. It's something that we've been doing for a number of years now. So every 2 months, we make a donation of £500 to a chosen charity. The way we do that is we put the names of our customers into a hat, in effect, and draw a name out. We will then contact you and ask you to nominate a dedicated charity, and we will make a donation to them. We're very keen at AlphaBiolabs to give back to the local community, and that's one initiative that we do. So once again, thank you so much for your time this morning. Please do take a moment to complete the survey, and we look forward to seeing you again next year now for our next round of Learning Labs. Enjoy the rest of your day and take care. Thanks very much. Bye.